Joining us now is Dr. Ezekiel Emanuel. He's a former Obama White House health policy advisor. He's the vice provost of global initiatives at the University of Pennsylvania. Dr. Emanuel, it's a pleasure to have you here. Thanks for making time tonight.
Nice to be back.
So, first of all, tell me if I got any of that wrong or if it seems like I'm looking at any of this backwards. I would be very happy to have you correct me on any of that stuff.
I would just emphasize two important points. One is there's a lot of unknowns here. We really, there's a brand new virus. We don't know how it's spreading. We do know that it spreads and that it has a sort of between 2 and 3 people get it from each infected person. We really don't know its death rate because we don't have enough cases. But I think, in general, you've got the story right. And I think we do need, as you said, a coordinated science-based response to this problem. And we need to be very well prepared. God willing, it won't be a big problem. But as we say in medicine, you prepare for the worst and hope for the best.
In terms of knowing the number of cases, I'm finding that the testing situation to be increasingly hard to get my arms around. I mean, how is it that South Korea has tested tens of thousands of people and we've apparently tested less than 450? It would seem like testing is an important part of trying to get a grasp on the scale of the problem and what needs to be done. How come we can't scale up our testing?
Well, one of the problems is that every hospital or public health community has to go back to the CDC to get a test kit. That seems like a mistake, especially now that we know there's community passage of this and many asymptomatic people are passing it. So we have to have a high index of suspicion right from the start, even if someone's asymptomatic. And I think you're right. We need to see tens of thousands of tests being done in this country, if anything, to just prevent further spread. We're not going to contain this. It probably, as the California case suggests, has broken out. But we do need mitigating responses to this problem and to try to reduce or isolate people who do test positive.
What do you think we should expect in terms of a time frame for that kind of scaling up that you're talking about? If that is key to trying to figure out how to mitigate the impact of this sort of uncontainable virus in terms of its spread, how fast could we be at the level where we've got 10,000 kits, tens of thousands of kits out there, and they can do it in all the states where they've got prevalence?
Well, I mean, if you had a whirlwind personality who was running this, that's, one step that they would take. Another step is getting all the state health officials together and talking about them and making sure everyone knows what the federal government is doing and what the states are doing and ensuring that there's close collaboration. You would make sure that we have enough personal protective equipment, the PPE, out there in all the hospitals and throughout the country. You would make sure that our drug supply is secure, since so much of the raw materials come from China and the generics come from China, and you have to get on that. I mean, there's a very long list that you need to do. I'd say the other thing we need to prepare for, and China made quite clear that it could threaten us, hopefully it won't, is surge in the hospitals. If a lot of people get infected, we may begin to overwhelm our hospitals. We have less than 1 million beds in the United States in all hospitals. What's the surge capacity? How are we going to respond if we have a large number of people? We still have people who have other conditions, whether it's cancer or need surgery. So we have to be able to handle that surge, and that needs a plan as well. And, taking care of the United States is only so good. We have to make sure that the world has an adequate response, too. So we need to partner with the WHO and other organizations in addressing this. So there's a list which is where you would start if you were taking over this and really pushing it forward.
Dr. Ezekiel Emanuel, senior White House health policy advisor in the Obama administration, now vice provost at UPenn. Sir, thanks for your time. It's good to see you.
Thank you. Hope that was helpful.
It is helpful. It's a good list. I'm taking notes. I think we all are. I wish I had more confidence that at the White House they were also taking notes, writing this stuff down. Maybe I'll send them a transcript.